Hi, let's do this sample question together. You have a 5-year-old dog that's 62 pounds, and that's 28 kilograms, with a 3-day history of vomiting that presents. You take the clinical parameters, and its heart rate's 160, so quite fast for that size dog. It has good pulses, it's panting, its mucous membranes are pink but tacky, and there's decreased skin turgor, so this patient has a skin tent. And the question is, approximately what percentage of dehydration is this patient? The answer is C, 7%. And that's because anything that's 5 or less percent generally isn't clinically detectable. So the fact this patient is showing clinical signs such as the tachycardia, the dry gums and the skin tent, this patient is showing clinical signs of dehydration. So the 5 to 6%, that's it would be too mild of a dehydration deficit to have these clinical signs. The opposite can be said for answer D. 10 to 12% dehydration would be very, very severe. That patient would be extremely collapsed and probably have far worse clinical signs than what is written here. So the answer is generally in the middle, it's 7%. And this is a really common exam question.